Namaskaram. Welcome to my channel. I remove the mask now. Okay, in my last video, I told you about the breathing, normal breathing, abdominal breathing, and deep breathing, that is abdominothoracic breathing. Hope it was very educative and it was useful to you. So now I come out with some extension of the same topic in an interesting way. Okay, last time I told you about the sitting posture. It is an erect posture. Okay, against the wall or without the wall, you have to sit like this all the time. Whenever you sit, you have to sit like that. Make a practice. So most of the problems of the spine, lower back as well as the neck, that arises from the postural mistakes done over the years. So better correct in the early stages and tell your kids and youngsters to sit properly whenever they sit and watch TV or do online classes or whatever. Make them sit erect. That is a posture to be maintained all the time whenever you sit. At the same time, I want to tell you that you should not slide back like this. You should not sit like this on the back, half buttock like that. No, it should not. It should be straight all the time. Should be straight. And sitting, you have to remember that sitting exerts 11 times more pressure on the spine than standing. So if you are on the IT field doing long hours of work, you have to take a break now and then stand up, walk around, take a deep breath and come and sit again. So you should not be sitting for too long also. That is another thing. Third important thing I want to tell you about is the weight of the head and the neck is about 5 kg. Some people may have more. And that head is being supported to the neck and it should be on the shoulders. That means in the circumference of the chest, within that, the center of gravity of the head should fall within the center of gravity of the chest. You got it? So if you do like this, bend, that means the center of gravity of the chest falls outside your chest. That means that puts a tremendous stress on your neck muscles and spine. And that will put you into a lot of problems over the years. So if you are on a computer for a long time, make the computer like this, at this level, eye level, and then do the work. Don't keep it low. Adjust it. Very, very important. All right. So that is one thing. And I told you about the deep breathing exercises. Follow that at any point of time. Whenever anybody asks you to take a deep breath, especially a doctor, when examining, putting a stethoscope here, there, at the back, he will ask you to take a deep breath. Then you have to do abdominothoracic breathing. Okay, and some exercises. Some other doctors have come out with videos. Raising the arm. Take a deep inspiration. Raise. Breathe out. So that also should be abdominothoracic. Remember all the time, whenever you do the breathing exercises, whatever it is, it should be abdominothoracic. Now, other doctor, cardiothoracic surgeon, has come out with a video saying that when you make a sound of Om, like Om, that means noisy expiration that produces a lot of nitric oxide in the body. He says that it produces nitric oxide in the body that dilates the blood vessels and that's good for you. So whatever, in that case also, whenever you take a deep breath, do abdominothoracic. That's I want to stress that point also. And especially for the benefit of the IT people who are on the long hours of computer work, next, just interlock your fingers like this. All right, keep it on the back, and then take a deep inspiration, abdominothoracic. Remember, then do like this. Stretch the chest muscles. Then out. Then do it again like this. Do it again like this out. A few times in the morning, 2 times in the evening. Every day you do that. That's good for you. Healthy living. That is the name of this channel. And then I want to talk to you about the lungs proning. You know what do you mean by proning? This is the prone position, lying down, lying chest down is prone. Lying on the back is supine. So those who have lung problems, especially this COVID time, lungs is like a sponge. Lung is like a sponge. Can you see this? Can you see this? Can you see this? This is the sponge. This is the lungs. So it is completely, in the COVID, there is a exudation of fluids into the lungs. So like a sponge, when it is soaked in water, the lower portion is heavy, upper portion is very light and dry. Okay, so if your patient is like this sitting, this is the head, this is the foot end, this is the head, and this is the foot end. Okay, if the patient is sitting like that, the water is locked here. Sitting portion, water will be accumulating at the back, especially at the back. So when the patient is in the prone position, that is little bit head down like this, water will drain automatically outside and lungs will become dry and oxygen saturation will improve. Hope you understand that. All right. So whenever you do this, like prone, put a pillow under the abdomen and small pillow on the head, and then you can do. One doctor from the Lung Care Foundation from the Gurugram Hospital has explained it beautifully in the YouTube. You can search self proning. You can search in the video, search in the internet and then the YouTube, and then you can follow that instructions very beautifully. He has explained. You can follow that. One problem is proning here like this head down position is some people should not do it. Those who have very high pressure glaucoma, like might put pressure on the eyes. That's one thing you have to be very, very careful. Another one is heart failure. That means coronary artery disease or ischemic heart disease. Those patients who are on medications, already there will be fluid accumulation in the lungs. So their position is like this. This is the head. That position is like this. Should be like this. Not like this or not like this. They should be like supine and up. So it's opposite of COVID proning. So they have to be like, you can do proning, you can do flat, not head down. So you have to watch on that issue. And another most important complication is you have some problem in the spine, spine injury, spine surgery, and those things, they should not do those things. So apart from that, all others who have COVID or recovering from COVID, like prone like this floating, and then deep breathing exercises you have to do, and you can get over this problem. Another important thing is you can use whenever there is oxygen saturation is low, you can use a table fan. You can see here, use the table fan, switch it on, blow the water, the air will be going on your nose, and take a deep breath. You can do like this. Do you understand? So when you do that, the oxygen saturation is bound to improve. There are studies on that, and they say that either to buy time before you go to the hospital, you can do this time. Especially this is useful for those patients of chronic obstructive pulmonary disease, COPD. Okay, and smokers, ex-smokers, and some pulmonary diseases or occupational disease, or those who have chronic obstructive lung disease. This is very, 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 very useful. Even others also, it will be useful, especially in this COVID time. You remember that may save lives. So with these small and important tips given this time, I think this is enough now, and we'll see you in my channel with another interesting topic. Thank you. Namaskar.